What happens during a speech therapy session? I'm Kayla Chaco, a speech language pathologist in San Diego, California, and I'm going to answer your questions. Speech therapy sessions will look different for everyone who receives speech therapy. When someone begins seeing an SLP, they're going to begin with a thorough assessment to identify which communication disorders are present. From there, the SLP will determine the best plan of action to treat this disorder. Both children and adults regularly seek speech therapy. Even though the end goal is often similar, speech therapists will use different techniques depending on the patient's age. Let's talk about speech therapy sessions for children first. Speech therapy for children can be done in classrooms, small groups, or one-on-one. The type of session your child receives will largely depend on the speech disorder that the child is experiencing. Each session will be catered to assisting the child's needs, which will vary based on the disorder. Some common speech therapy activities for children during a session would include playing, reading books, identifying objects and pictures to stimulate language development, and there'd be a provision of homework and life strategies for the child's family so that they can continue to work on the goals at home. Now let's briefly talk about a speech therapy session for an adult. Once a speech therapist has determined which speech disorders are present, a plan is going to be crafted for that adult. Most adult sessions are one-on-one, but group sessions do exist and are very successful. So this is going to look different for the adult based on the disorder and the age, of course, but some common exercises that might be used would be something like memory building exercises, conversational tactics to improve communication, breathing exercises, and often it's a lot of talk. It's a lot of back and forth. It's less like the children therapy where it's like worksheets and homework and assignments. It's very often a back and forth between the therapist, and within conversation, they're working on the skills that they need to. Now, in general, the sooner speech therapy begins, the better. It's especially important with children as developmental issues can be corrected and entirely eliminated if treated quickly and intensely in the beginning. I know that right now finding in-person speech therapy is very difficult because of the challenges of the pandemic. And if that's you, man, my heart goes out to you. And I just want to tell you that I've created an online course to help during this time when getting access to that therapy is so difficult. So I've got this online course so that you can watch and learn my step-by-step guide for what to do with young children. This is for kids under the age of 5 who are learning to talk. Check this out on my website, How to Teach a Toddler to Talk. Excellent resource for you to take action and start making progress at home right now while on those wait lists. Many blessings sent out to you, all of you in the world. Please like, subscribe, and share this video. Post a comment with a question that you have below. I'd love to hear from you. Thanks for watching. I'm Kayla. Happy talking. Bye-bye.